Hello, everyone. I've got a very special guest on the show. It's all about stem cells today, and it's in a revolutionary application, medical procedure or application that I think so many people are going to benefit. And I've got an expert on the show. She's all the way from California in the US. In 2019, she was voted the top doctor in stem cell therapy. It's such a privilege to have her on. Welcome to the show, Dr. Joy Kong.
Thank you, Dr. Steve. It's great to be here.
Excellent. Dr. Kong is a medical doctor, a triple board certified physician, an anti-aging and stem cell specialist. And so that's why I'm having her on, so we can discuss how this, new sort of, I don't know about biohacking, but really cutting edge technology that people can apply in their lives to treat a lot of chronic diseases. If someone's listening right now, I do want to get into your backstory, Dr. Kong, because you've got a very interesting sort of fusion of West and Eastern medicine training and application and holistic medicine that you do at your clinic in California. But if someone's listening, and we need to grab their attention right now, they're listening and they're saying, what is stem cell therapy and why is it so important? What would you say to them?
Well, only that we all came from stem cells. So if you know how you came about, that's what kind of a power that's inherent in stem cells, because that contains the intelligence that makes you, that we all came from a single stem cells, a fertilized egg, and from that one cell, the cell somehow knew how to divide, how to migrate, how to form different shapes and structures, and then make this complex miracle that's each one of us. So what stem cell therapy, why it's so revolutionary, is that we're tapping into that kind of intelligence, that kind of almost limitless intelligence to help our body to heal. So that we've never had anything like that before.
Brilliant. Now, someone's listening. What are the top, say, 5 conditions? And they might be thinking, they might be hearing this, driving in the car, they're listening to the podcast, or they're watching on YouTube. What would you say the 5 top conditions are that people can use stem cells to improve their health?
Okay, so Dr. Steve, you're going to get me in trouble. First of all, I can't make any claims. So because the FDA, first of all, there's only one FDA indication for stem cell therapy, which is using stem cells either from bone marrow or umbilical cord blood, wherever it came from, to treat blood-related diseases. So if somebody had, kind of had blood cancer or blood disorder, they can wipe out the bone marrow and they can transplant the stem cells back into the body. That's the only FDA indication. So I can't talk about what conditions, it can treat, but I can certainly share research,
Yes.
Evidence of what conditions that research have found to be very helpful. And first of all, one broad category is autoimmune conditions. So you can look at, all these immune dysregulation like lupus, rheumatoid arthritis, psoriasis, or even diabetes. There's autoimmune component. So a lot of these autoimmune conditions, because the stem cells have been known. So when we talk about stem cells, there's so many different kinds. So really, I'm mostly referring to mesenchymal stem cells. These are the type of cells that actually are in our body all over, anywhere we have blood circulation, there are these stem cells, but they do dwindle as we age, to almost non-existent, when we reach our 80s. So they kind of go, a straight line down in their decline in numbers. So when we give the body these signals, these cells have the ability to change your immune system. So it can shift the system from a very inflammatory state to anti-inflammatory and regenerative state. And because a lot of these conditions have to do with inflammation, dysfunction, so your immune system has not been able to allow the body to shift out of that inflammatory condition. So these cells are very, very powerful in that sense. But the cells have all kinds of other capabilities, including things like anti-cancer properties, antimicrobial properties. It help nurture the formation of new blood vessels. So keeping up the blood supply. It also can protect dying cells when it can be saved. And it also has ability to, of course, calming inflammation, so huge in anti-inflammatory condition, but also produce this local effect where it can communicate with the local environment, so it can bring about the right element from the immune system, either to take away bad cells or to, send the signals so local cells can engage in proper actions for regeneration. It actually talks, these mesenchymal stem cells talks with the local stem cells. So we'll have tissue specific stem cells. And we are able, so these cells are able to send these local cells like livers. In the liver, you may have liver stem cells. So these cells, if you don't have the correct signals, it may not, may just sit there and not really engage in any reparative, regenerative actions. But these stem cells was almost like speaking their language. So it's, let's say Portuguese, it's speaking just the right language. So the cells are like, okay, now I know. So that's the range of action. So when you ask for 5 conditions, autoimmune is a big category. And we can look at, COPD. I've seen great success in my patients. These are very, very difficult conditions. People are stuck on medications and oxygen, but, I've seen people getting off oxygen and getting off medications, and liver conditions. And then, of course, things like osteoarthritis, which really is a systemic inflammatory condition where your body cannot keep up with repair. So I've seen stem cells just doing miracles, saving people's knees, either from chronic, severe debilitating pain, or saving them from getting any kind of knee replacement surgeries. So really the research results have, shown from head to toe, lots of great benefits because of the broad range of actions. It's really because of how these cells work. That's why if you have a condition that has high inflammation as part of the picture of the disease, and they have immune dysregulation, then there's a good chance that these cells, because of how they work, that they can help promoting the repair.
Okay, so there's a lot there. There's a lot of value. You might be listening now. So autoimmune, we're talking about the research. We are not talking from Dr. Kong, sort of advising or saying it treats or cures. We understand that this is not medical advice, and we do have, these disclaimers in the podcast. But so someone's got autoimmune, a lot of inflammation. That's the first thing. Then osteoarthritis, regenerating cartilage, ligaments, tendons. You've seen significant lung conditions like COPD, liver conditions, and possible cancers that you've seen in the research say that they're quite beneficial. And would you say those are the top 5? What about neurodegenerative, those that are going through Alzheimer's, Parkinson's?
I've actually treated people with different neurodegenerative conditions, and like things like Parkinson's, like MS, multiple sclerosis, and Alzheimer's, and in particular traumatic brain injury, because I've originated a study, clinical study on this condition where we do stem cell treatments, in a series of 3 treatments, and then we're able to track the changes in the person's brain and in their function. So definitely in neurodegenerative conditions, there has been some really great results.
For those pinging, if you're listening to that, is Dr. Kong is extremely busy. She's a CEO, she's an educator, and she's giving up her time for the Made to Thrive show. So, we're going to have links to her clinic and her products that she's developed in that. And so, let's talk a little bit about what a mesenchymal stem cell is, because some people might not understand that and how it communicates and connects with other cells. If you were explaining to my little 5-year-old what a mesenchymal stem cell is, what exactly is it?
Okay, so a stem cell, it's a little bit of a complex world because life is complex. So when people say stem cell treatment, I'm getting stem cells, but what kind of stem cells are you getting? There's so many kinds. because when we, the first fertilized egg, that's the grandmother, of all cells, right? So that it's full of potential. And when that cell started to divide within the first 5-7 days, and almost each individual cell can form an entire human being. So that's what embryonic stem cell therapy was, that's what they use. On day 5 to 7, that's when they take the cells from that little ball of cells, and that has massive potential. But as they further grow in the ball and they start to have this, convolution and start to make different structures, then these cells will start to specialize. So they will gain specific function and lose some other functions. So they all have their different lineages, but they're still stem cells. So all these are still stem cells, and they start to divide and divide. So you can see there's a range. It's almost, it's infinitesimally, small changes as these cells evolve. So where are you stopping? What are you getting? What kind of stem cells are you getting? So that's one big issue. So when we talk about mesenchymal stem cells, that's really one type of stem cells that actually is residing in our adult body, which means it already has a more particular lineage. It may have some potentials in a petri dish to grow into different cells. Actually, they've shown the mesenchymal stems can be, coaxed into form, muscle cells, bone cells, fat cells, or even liver cells and neurons. So there's, this potential, but it's not everything in the human body anymore. But they play a critical role, which is why, the doctor who discovered the cells actually want to rename the cell. Instead of mesenchymal stem cells, he wanted to rename them as medicinal signaling cells, because that's really what they do in the body. So once these cells are coming, we're forming a whole body. These are the cells that are hovering all over your blood vessels. So everywhere you have blood supply, which is just about everywhere, right? Along the blood vessels, you will have these mesenchymal stem cells, these MSCs, that are huddling over it. So what they do is almost like they are the conductor in the symphony of the regeneration of the body. So they're sensing what's going on in the blood, and then they're also keeping track of what's going on in the neighborhood. So they are able to conduct, what's needed, what is there a signal in the blood where I need to get in and go to that place to repair, or should I send signals into the blood so the blood can send something over so I can help repair the local tissue. So they're constantly, having this conversation. So these are the cells that are providing this crucial function to modulate, to monitor the body and make sure that we are repairing what needs to be repaired. So that has been a very safe way to do stem cell therapy, because these cells have differentiated in certain, direction where they don't have the capacity to become anything else anymore, because the problem with embryonic stem cells we still haven't been able to solve, and that includes the induced pluripotent stem cells. So that's something that you can almost revert back to an embryonic state from adult cell, like some the researcher did using skin cells. But the problem with these cells is that they're so primitive, they're so wild in their potentials that they can form anything. This is when we have these teratoma risks. So these are uncontrolled growth of clusters of all kinds of tissue that they form a ball. And that's when you hear people, get some injection in the back, all of a sudden they're growing a tumor in their back. So these mesenchymal stem cells, because they're, further differentiated, you don't have that problem anymore. It doesn't go wild. And then there's also a difference between what you use, whether or not it's from a newborn, when the cells are still very young, or from adult, somebody that's, have grown, even in 30s, 40s, or, all the way to 80s, the stem cells in our body have become quite different from this, what we also call MSCs that's in the newborn or in the newborn tissue. So the newborn, the what they call perinatal tissue is the placenta and umbilical cord, right? So that whole cluster that usually get tossed away, but that's full of important these regenerative cells. And what's fascinating is that in the birth tissue, the cells are actually more primitive than the cells in the newborn baby. So they may both be, 0-day old when they're born, but the cells that are, for example, in the umbilical cord, they got trapped really early when the embryo was forming. So these cells have characteristics kind of in between the embryonic stem cells and the baby's stem cell, 0-day old baby. So there's all these nuances that people are not really understanding. So that's what I'm trying to make sure that people know, that not all stem cells are created equal, that there's huge differences. And the beauty of what's in the perinatal tissue is that not only they're more primitive and they have more potentials, but they don't have the wild potentials as the embryonic stem cells, right? That can cause this tumor, but they are more potent than our adult stem cells because they are more primitive and they're more effective. So that's been supported by a lot of research.
Wow. Now tell us about, we're just going to your story a little bit. I think it might be sort of inspiring for many listeners, how you got into stem cells in terms of your own health journey and why you picked this amazing sort of new technology.
I think, first of all, of course, I grew up in China in my first 20 years, and I always talked about how, there's no discrimination between Eastern and Western medicine. Of course, the Chinese medicine's been around for thousands, at least 5,000 years, and how it had, done a great job, keeping a population flourishing. And there's a lot of wisdom, a lot of kind of empirical data, right? So basically you have conducted large scale population studies on what works, because if it doesn't, people are not going to keep using it, period. They're not dumb. Why would they keep using something that doesn't help? So there's inherent value and wisdom in what those medicines can bring. But then I love science. I grew up on the top science and technology university in China, and I'm in love with science. So Western medicine has tremendous amount to offer. Look how far we've gone. The organ transplantation and treating infectious diseases is amazing. But I also want to tap into the wisdom of Eastern medicine, because I've seen how in chronic conditions, Western medicine is rather helpless. I mean, it's rather sad. I've worked in lots of clinics, including the Veterans Administration. So I've seen a lot of veterans, and they all come into the clinic with a huge bag of medications. Basically, their journey in health is keep adding medication after medication. One doesn't work, or one causes side effect, and they add another one. Is the medications rarely taken away, so they all end up with a bag of at least 6, if not 30 medications. So that's where Western medicine has ended up in, when it comes to really this chronic issues is helpless. So how can you tap into something that can keep a person healthy? Because we were not taught in medical school how to keep a person healthy. That was not emphasized. That's not even really. Maybe we spend half an hour talking about how to keep a person healthy. All the other part is about waiting for people to get sick so we can diagnose them and give them medications. So that's entire approach. So I always wanted to bring the two together so I can give the best to a person in front of me. It's not until I encountered anti-aging medicine. I think people have a misconception of what anti-aging medicine is. They think it's about preventing people from getting old. No, it's actually preventing you from declining. This is not about, I don't want to get old. No, you don't want to decline. Who wants to decline? Who wants to lose functions and vitality? So anti-aging medicine is about preventing everything that comes with aging. We still haven't categorized aging as a disease, even though it has all these markers of disease. It's simply a prequel to outright diseases. It's almost like a comorbid condition, right? So you have aging and you have diabetes. You have aging and then you have osteoarthritis. So just why is it we can categorize people can have psoriasis, can have, liver cirrhosis, and have all these other conditions like comorbid conditions, because you have markers for these other conditions. but aging is not. They don't want to categorize aging as a condition, but it is. So what can we do to prevent that decline? And in understanding this whole discipline, I realized that discipline inherently are tapping into the wisdom of Eastern medicine, because they're actually looking at these herbs, these vitamins, all these, approaches that are looking at many, many factors in the body, and they're treating the body in a more holistic manner, because a lot of these herbs have multiple functions, right? An herb can have 100 chemicals or molecules in it that could synergistically may do something together. So when I looked at this anti-aging medicine, that's when I thought, okay, finally, there's a language and there's a mechanism where I can bring the two together. And stem cell therapy is actually, kind of a branch of anti-aging medicine, this regenerative therapy. And it's really beautiful because this is the first time that we're not giving a person a drug, which is a chemical, and we're not giving them an herb, which is a collection of chemicals or molecules. We're giving them information, because what are cells? The cells contains DNA. The DNA have the capability to respond to the environment, to give out signals, to change what kind of protein they're going to make so that they can, change the response to what's in your body. So this is the first time that we are infusing information. And what is DNA? DNA, it's energy. It's the most energy dense substance in the universe. So when I give people stem cells, I'm actually giving them incredible energy that has intelligence. Yeah, so that's why I'm so excited, and talking about holistic, addressing the whole body, and this is like a holy grail. It's a way, a whole step beyond herbs. And thanks for Western medicine, right? The Chinese didn't come up with stem cells.
Yeah, it's fantastic. And, I think more practitioners are going to be combining, the alternative, complementary and traditional Western medicine. In my other life, I'm a physician as a doctor of Chinese medicine for many, many years. And just, the power of Chinese medicine, from prevention to treating different diseases with different protocols, treating same diseases with different protocols, looking at the root of disease. We've had Dr. Jeffrey Bland, he was the father of functional medicine, on the podcast as well. So we like to look at, the cause of diseases, make sure that we address those and not just treat symptoms. As brilliant as Western medicine is in many regards, very good at emergency medicine, is the chronic stuff. Functional medicine, integrative medicine, holistic medicine, complementary medicine, I think is probably far more beneficial there. But so tell us, a patient wants to come and see you, or patients wants to inquire about stem cells and look at their own stem cells, probably their bone aspirate, or they're looking at lipo aspirate, or they're looking at, we talk about perinatal tissue, you said, from, placenta cells or umbilical cells. What should they do? How should they find out if they're in South Africa or Africa? How do they get stem cells, and what's good stem cell therapy? What's not good stem cell therapy?
Yeah, first of all, they definitely need to figure out what source they want to use, because that gives you a whole, divergent routes to what you want to get, kind of therapy you want to get. And I actually, just for that reason, I put together a lecture. People can access it on YouTube. It's called "Are All MSCs Created Equal?" So if they can just look up my name or just put that in, "Are All MSCs Created Equal?" I've given that lecture at various conferences, stem cell conferences, and even among group of physicians, that's still the type of information that hasn't been talked about, and a lot of doctors don't know. Doctors get locked into, oh, I do bone marrow stem cells, or another one I do fat derived stem cells, another one just I do perinatal stem cells, umbilical cord. But okay, you're all bought into your own group, but really, what's the best for the patient, right? Are they all the same? Or is one superior to another? So just to answer that question, I looked into lots of research. And so in that lecture, it's a 40-minute lecture, I delve into all these different research results, because people have done comparisons, believe it or not, people have done research for years trying to compare these different sources. So when I looked at these different sources, to me, there's really no there's no doubt in my mind that the umbilical cord source, the peritoneal source, of the three, that's a superior source. Not only the cells are, like I said, they're more primitive, so they have more potential, they're more active, they have more anti-inflammatory effects, and they have more generations left. Their mitochondria is healthier. So, and then also they're safer. What's fascinating is that as we get older, our stem cells get older with us. There's no way around it. They all age with us. So these older stem cells, not only they start dying off, but as they get older, not only are they more sluggish, but they're also losing some of the intelligence that they should have to keep us safe, because the mesenchymal stem cells, one of their capabilities is to be able to detect cancer or precancerous changes or senescent cells. So when cells are older, these cells are able to recognize that these are abnormal cells, and they can send the correct signals to make these cells die. So, it's called programmed cell death. So it sends them onto that program. But as we get older, the cells from our own body, the same, you can call, they're all mesenchymal stem cells, but they're older mesenchymal stem cells. They've done studies that they put, mesenchymal stem cells from an adult person derived from fat next to this, brain tumor, glioblastoma multiforme. So these cells, they put it either in petri dish or in a live animal. So they've done the study both ways. In either case, the cells from the fat, the mesenchymal stem cells from the fat made the tumor grow, but the mesenchymal stem cells from the umbilical cord made the tumor go away. That's how vastly different they are. So be very, very careful. So I personally, I just think it's a more effective way to help patients. Of course, there's also advantages of how convenient it is for a patient. The patient doesn't have to have their bone marrow drilled, out, and they don't have to get a liposuction. And it's just funny, I tell people, and it's common sense. When you drill a bone or when you do a liposuction, you just created an injury, right? You just created a very acute injury. So that area is screaming, help me repair. So a lot of people will get cells out of those areas, and then they put it, into the intravenous route. And guess where the cells really want to go? You just made some damages. So there are a lot of reasons why I think the cells from the umbilical cord is superior. So that's the first thing you need to know, is what kind of cells you want to use. And also, I think a lot of people bought into the idea that more cells are better, and which is not true. So if you have the same kind of cells, yes, maybe. But if you start to grow the cells as if the cells can just grow on trees indefinitely, that is naive. Because what happens when you try to grow the cells, first of all, if it's beyond fourth generation, there's definitely going to be deterioration going on. The cells are going to degrade, going to have cellular changes. So you don't want to expand it to many generations, first of all. But a lot of these companies, such as, I know definitely in Mexico and Panama, there are clinics that grow cells into large numbers. So we don't know how many generations they expand. There's no clear, as far as protocol that I know of that they are, sharing with the public. But what happens is not just how many generations, but the conditions of how the cells are expanded. So first of all, in the US, you cannot use expanded cells without conducting the clinical study, which I do agree, because you're changing the cells. You're potentially causing artificial changes, and what's in the medium that are, that cells are growing in makes a big difference. And the type of, even the vessels are important. So a lot of times when a stem cell, divide, they don't divide evenly into two stem cells. Very, very often, they want to divide into a daughter cell and a stem cell. So the daughter cell is just, it's gaining further function. It has more surface receptors expressed that they have, they're a little bit more specialized. And what's the problem of growing into a daughter cell instead of continuing to be a stem cell, is that these daughter cells will have it will have expressed more of the person's own genetic material, and that can potentially cause more rejection. Whereas a stem cell, a true stem cell, there's no surface markers that mark them as, Jane or Joe. They're just very, very, kind of nondescript. So you don't have the issue of rejection. But when you start to differentiate, that's when, people have more side effects. So what I hear about, in a place like Panama, people are getting 3 injections within a week. And I see no reason for doing that. And I actually asked, the main scientist in the clinic of why there's such a technique, because I just give people 1 injection. I don't see a reason to do a series 3. And one of the issues is side effects. So, and people have noticed as they get second injection and third injection, side effect actually mounts. But guess what? Because your immune system just got primed to respond to this newcomer, which is from another person, because the cells have differentiated. So there are all kinds of issues, but people get fooled by this large number. They say, oh, I'm getting 200 million cells. I'm getting, 300 million cells. Isn't that amazing? Whereas when I give people stem cells, it may only be 20 or 40 million cells. But guess what? When I put 20 million cells tomorrow, you're going to get 40 million. And then, give another 28 hours, then it's going to be 80 million. So, I don't think there's a better incubator than the human body. That's where the cells are meant to be. So instead of putting in an artificial environment, so people get, allured into these, these hypes. So that's another thing, find a clinic that will give you high quality cells, and then be aware of these highly, these expanded, type of cells. And in the US, if you do not change the cells by either using chemicals, or enzymes like, fat-derived stem cells, a lot of times they use collagenase to break down collagens. So that can also digest surface receptors of the stem cells. So that can change cell structures. And then if you start expanding cells, then it's also considered basically you're changing cell structures, you're making a drug. It's no longer a tissue transplant. So that's when the FDA says, if you want to do any of those things, you're changing the cells, then you have to apply for an IND, so investigation of new drug. So that is a very, very expensive process. So a lot of people, that's why they go overseas, because they can't do it in the US. But what I use in my clinic, it's really true tissue transplantation. So these are cells that have never been altered in any way. So how they came, that's how it's delivered.
Great. So let's talk about the application. Is it intravenous? Is it injection into different sort of joints? Or what would people expect? Is it umbilical cords? Is it placental cells as well? That's also included, because some people didn't keep their umbilical cords. A lot of people that have aged, they don't have their own umbilical cells. They don't have their own placental tissue.
You don't need your own.
Yeah.
You don't need your own, because of the fact that these cells are, are kind of a blank cells, that they don't have the surface receptors, and they don't live in your body forever. So even if, let's say I'm getting stem cells from your fat tissue and I put in your body, there's still an attrition rate. So the cells will gradually die within a few months. So once you activate it, once they start working, there's a lifespan. So those cells won't live in your body forever. Same as these cells from the umbilical cord. So it won't promote that kind of immune reaction. And once in your body, once you start doing the work, sending the signals, travel to the site where they're needed, there's a finite lifespan. And most of them will die, but some will stay. There's still, that's a $6 million question of how much will stay. When I talked with all these, some of the prominent scientists, stem cell scientists in the world, I'm getting the answers, maybe 2 to 3% maybe stays in the body. So there's a small percentage. And by the way, the fact that foreign cells stay in the human body is actually widespread in nature. They actually found that 60% of women have Y chromosomes in their body. So these male chromosomes actually are in the body. So they can't explain it just from, a woman that have given birth to male children, or, they have miscarriages of male children they didn't know about. Or they have, when they were in the womb, they have male sibling that died, no one knew about. So they accounted for all that. So the only way they could explain is through male and female intercourse, and that some of the Y chromosomes actually got into the human body. So which means that this is a natural phenomenon that, we have other people's cells that can live in our body. So they've found that the Y chromosomes in everywhere, in the brain, the breast, like everywhere in the body. So that's something that can happen, and it's okay. It's part of being human. So when it comes to injection routes, because you have to be injected. I've heard of people saying, oh, they were ingesting, eating stem cells. I was, oh my God, great. You got some proteins, you got some nutrition. You're not getting the cells, you're not getting the intelligence. You're just, destroying all the cells. So no, it has to be injected into the body. You can't eat it. And so depending on what we're dealing with. So if there's any kind of systemic issues, then definitely I will, I do like the IV route, because I love seeing how the cells will use their own intelligence, just travel to where it's needed. So, but the quantity is important. If you have a lot of inflammation, a lot of injury, it's only so much stem cells to go around, right? So let's say I give somebody 20 million cells, and all of a sudden, there's an acute injury or there's a chronic injury somewhere, and 10 million cells, all went there. They were like, this is, I need to be here. So then they start doing its work. And when they were doing their work, there is also an attrition rate, because when they're fighting inflammation, the inflammation is toxic. Just like inflammation can kill your own cells, they can also kill the stem cells you just gave somebody. So then you only have 10 more million to go around. What if you have 5 other spots that needs repair? So the number is important, but this is why sometimes you may need a series infusions, depending on how much problems you have, how severe they are. So if somebody has any kind of immunological issues where there's immune dysregulation, there's, rampant inflammation in the body, definitely the IV route, or even for brain conditions, because I do believe a lot of these, various diseases are a manifestation of overall inflammation. They just happen to show up in different organs. So by changing the immune system, by strengthening the immune system to go in and fight the conditions, that's one of the ways it can be helped. I do different treatments in my clinic. So one is, overall, for different organ systems and for the brain and for autoimmune, issues. But I also do a lot of muscular skeletal treatment. So people have like tendon, muscle, or joint injuries. A lot of times I can just inject into the local area. But for larger joints where there's very slow blood perfusion, the exchange between the blood and what's in the synovial fluid within the joint, the exchange is so slow. It's going to take a couple months to get things in. So you want to inject right into the joint. For larger joints, smaller joints are much better infused, perfused by the blood. So for larger joints like the knee, the hip, shoulders, then I tend to inject into the joint space. Another issue to keep in mind is that I think one of the reasons I have really high success rate is because I address the whole body as well. A lot of doctors will just inject locally into the joint, but osteoarthritis, as far as inflammation of a particular joint, is really a reflection of your entire body's lagging ability to repair. So there's inflammation that your body cannot reverse because your body is inflamed, is in a state of disrepair. So Then I will give an IV treatment along with joint injections, especially if you consider larger joints. The cartilage in the larger joint, the outer 1/3 is nourished by the blood supply. The inner 2/3 is nourished by the synovial fluid. So you want to attack from both angles. And I've actually seen, from people who didn't really come to me for joint repair, they just came to me for anti-aging treatment. I give them a IV stem cell treatment, and they saw in their MRI, they were following up with their doctor for some other issues. And then they realized that the cartilage had grown in the knee. So that just from a simple IV treatment. So it's really fascinating. There are other treatments we do, like facial rejuvenation, which is really cool. And then also hair restoration, which I've seen great results in. And then we do sexual wellness. So we can inject stem cells into the penis, into that, vagina, and that can enhance sexual function. So it really depends on what we're dealing with.
Good.
Yeah.
So I listened to your podcast with Luke Story, which I thought was incredible. What do people feel afterwards once they've had all these stem cells? And, I just think of, is their personality imprinted on these stem cells? You've obviously got a sperm and egg, they come together, then obviously develop into the blastocyst and all these things. Firstly, there's two questions, and sorry about that, but you speak so well and so fluently that the time is passing. But is there any personality that's imprinted, like any research to show that someone has a stem cell, treatment, and then they have sort of personality changes, or they have supernatural dreams? Or that's the first question. And then secondly, someone who's like Luke's Story, the biohacker, and we'll link to that episode that you did with him. But what type of, improvement did he get? Would he be prepared to say, hang on, I felt so good, I didn't feel good, I didn't change? I mean, he's been in the health space for a long time. I've referred to his podcast for a while, but tell us about those two questions.
So the first one, what was the first one?
The first one is there imprinting of personality or epigenetics,
Right. I haven't seen that happening. Because like I said, these cells, they have specific functions, they have this overall kind of immune modulating, and this just getting your body more primed for repair and regeneration, and then they have a finite lifespan. So I don't think the personality, that really is determined by our brain structure, and it is very complex. And I don't think we're shifting the brain, I don't think that's happening. I mean, if that's the case, I would have had, probably, 20 different characters in me, because I've had many people's stem cells into my body. So that I don't think it's possible. Not for the quantity of what we're giving people. But the second question, what people notice. So there's definitely a wide range of responses. So Luke is a while ago, but I think he definitely loved what he got from it. I forgot exactly what the benefits, but as far as benefits, I hear a lot from people. There's definitely, mental clarity I've heard about. I just spoke with one of the nurses that I treated. I gave her stem cells, and then she mentioned how it benefited her emotional well-being tremendously, and also increased her sex drive, which I hear quite a bit. So basically there's, huge vitality, feeling, sense of well-being. So that I hear a lot, just sense of being well, a heightened energy level, and stamina. So as far as, when you work out, so there's this kind of just vitality that's blossoming. And then I've heard people who have improved vision, where they thought their glasses were not working, that their vision was getting worse. And then they went to the doctor, and turns out that they have to have a, lower prescription because their eyes are improving. And of course, reduce pain, joint, like stiffness, pain, going away within days. People have noticed improvement in hair. Instead of losing hairs, have less loss of hair. So people have thicker hair. So and of course, when people have different conditions, have different diseases, it's a lot easier to gauge what's going on. Then they will tell me how, their breathing is better. Or, I remember a woman I treated with Alzheimer's. She couldn't eat, like she just didn't, she was pretty late stage. She wouldn't feed herself for over a month. And then the day after the stem cell treatment, she just picked up a knife and fork and just fed herself. So that's a huge change, which I believe is an acute anti-inflammatory of the cells, where so much inflammation was accumulating in her brain that the cells are not just able to communicate. And then they're just this stagnation, it's complete blockage. All of a sudden, the inflammation's down and the cells are talking to each other. All of a sudden, it's not a big deal to pick up a knife and fork and feed herself. So you can have a lot of disease-specific improvements.
Sure. Okay, let's talk about cost, because the average person is probably going to ask that question. I mean, in the US, not sure about South Africa, but it's quite a costly process here. From the last time we looked at it pre-COVID, obviously COVID's had a huge impact on a lot of the stem cell clinics and finances that people have available for these sort of cutting edge techniques. But tell us what's happening in the US. Is this available to a lot of people? Is the cost coming down? And is it going to be sort of available to the average person in the street?
The cost is not coming down. It is rather expensive treatment. Unfortunately, I think as long as there is a suppression of stem cell therapy and, making it difficult, a lot of doctors are scared to offer it. Somehow there's an idea that is not legal, which is kind of ludicrous because, we have the FDA guidelines, which has not changed. Saying, well, unless they're doing the expansion and they're using chemicals, then they have to do, they have to apply for IND, which is, millions and millions and millions of dollars. Then they can't afford to do it. So people were doing it before. Anyhow, now the FDA is cracking down, so they're scared of doing it. But for a lot of doctors who are doing what I'm doing, which is using unchanged, what's called minimally manipulated cells, we can do it because it's tissue transplantation. That's within our medical license. It's like giving blood transfusion, right? Doing liver transplantation. It's not a drug. The FDA is not regulating it as a drug. So, but as long as a lot of doctors are scared, a lot of insurance companies are not covering for malpractice, then the cost is going to continue to be high because the doctors feel exposed. They feel like they're taking on a risk. So the cost, but it still is not prohibitive. I think overseas it may be more prohibitive because of what I see, what I've heard is, between $20,000 and $30,000. That's pretty common cost for overseas. In the US, the cost is probably between a few $1,000s to all the way probably to $30,000. At our clinic, I just try to make it very reasonable, very affordable for patients. It's still expensive, but in my clinic, a single injection into the joint, that starts at $4,000. And for IV infusions, the average cost, depending on how much a person needs, because it all depends on their body weight, their age, and their health condition. But generally it's between $7,000 to $15,000 for an IV treatment. So we try to make it, easy enough for people. It's still not cheap, but I think it's reasonable enough that people can do it, even on a regular basis, because I do have patients who come to me, either every 6 months or every 3 months or every 2 months to do an IV treatment because they know how much this is, improving their vitality or even dialing back the clock, which is pretty cool.
What are the thoughts on, studying Chinese medicine many years ago when I sort of graduated, that the Chinese were taking umbilical cord or placental cells straight away from, the wards in the hospitals and taking those, drawing those up into syringes and then injecting people who had a lot of pain in different areas. Obviously, one of the tenets of Chinese medicine is blood. And trying to get blood to certain areas, not knowing that there were a lot of stem cells in those. They had some type of idea in terms of injecting these all over the body. Do you have any experience with that? In China, obviously, possibly maybe less regulation. They've been injecting autologous blood into different areas, drawing up blood from patients and injecting them into different joints and different, sort of tendons and ligaments. Do you have any experience about that?
I didn't know that. I just, only thing I knew was in Africa that people, when people have a wound and then they will put the placenta on top and help wound healing. But I didn't know. I mean, I knew growing up, my mom actually cooked a placenta once. So it just tastes, like, I don't know, what do you call it? Chicken heart or something. I don't know. It just, but then you're just getting protein. So I didn't know they were doing injections, but that's interesting. Actually, when talking about China, they do. I think they're probably the second largest when it comes to stem cell research. Second to the U.S. So it's very active in research, but the government has taken a little bit of kind of conservative stance. Because, I think it became a little unruly, being ruly is very important in China, but I think too many people have got into it, and they were finding a hard time to regulate it, to make sure that everyone's doing an honest job, is giving people what they say they were giving. So then they just decided to kind of make it difficult. And then they made a rule that you can give stem cell treatment, but you can't charge for it. So that kind of took a lot of incentive away. Quite
funny. Okay, Dr. Kong, you're a healthy individual. You look exceptionally well. We know I had Dr. Bruce Lipton from the Biology of Belief on the Made to Thrive show, which was incredible, talking about epigenetics, talking about stem cells, the environment being so important. Tell us about your evening and morning routine. What do you do in your life to, keep, healthy and well? And obviously, I've got a huge biohacking audience who listens to the show, and they're looking at cold thermogenesis and infrared sauna and fasting. And there's some sort of talk and research on the release of stem cells with long fasting protocols. What does your life look like, and how do you improve the environment that you place those stem cells in?
Yeah, that's hugely important, because I always stress an integrative approach to stem cell therapy. If you only look at injecting stem cells, not doing anything else, then you really know better than the traditional way of just thinking that the body is simple. The body is very complex. If you have toxins, then the cells are not going to do well. If you lack certain vitamins and minerals, your cells are not going to do well either. So I try to address all those things. Of course, I take some supplements, not excessive amount, but some essential ones, like the vitamin D's and the fish oil and pregnenolone, to help with the hormone balance and, alpha lipoic acid. So certain things. And, but, my routine is that, I get up in the morning. So I do a little bit of meditation. I actually start using the brain tap to help me to get into a more because it uses light and sound, and it's interesting. So I like that. And I love my kitties joining me. So we're kind of like doing it together. And then, and then I'll go to my Pilates. So I love Pilates workout. So it's actually like Greek fitness, which is kind of a step up, a more cardio, that incorporates more cardio into the Pilates workout. So it's a more complete workout, which I really enjoy. So I do that every day. It's like, I call it my religion, and because you've got to move the body. So once I did that, I feel like I'm good for the rest of the day. Although sometimes, I sit around so much, reading and doing, work. So I do have a vibration plate, because you will feel kind of stagnated, legs feel uncomfortable. So I'll get on the plate and do some of that. And, or, feeling that hopefully that's a little bit of exercise, supposedly, right? That helps, it's a small exercise. And then I've 4 or 5 days a week, I'll do infrared sauna. So I do have a big sauna at home. I love getting into it. And one of my kitties also love it. So we do it together. And black cat, I don't know how he's able to, I don't think the black color matters, but he does it with me. She does it with me. And I have an inversion table, which I really like as well, because, we we don't give enough blood circulation to the brain, right? We're always, straight up. And so we do, it's great to help with brain health, but also it's great for the spine. So I do that, 4 or 5 times a week. And then I have a PMF mat, and then the red light therapy. So I have set up where my face will be covered by a light therapy device, and then I have the red light, all around me, and I'm on the PMF mat. So I do a little session, which is great for your cellular health and great for skin regeneration. So so I do that for 5 times a week. Yeah, so I think those are my main routines. Yeah.
Sounds good. You sound like you're a pro biohacker like myself, getting out there, using these biohacking tools to improve your health. Okay, so last question. I think we come to the end of the show, and hopefully I wanted to get into ketamines and have a look at your history on that, but maybe possibly next year we can chat about that and brain health and addiction. And you're obviously board certified in that as well, which I think is very important. Not many people know about ketamine, and maybe we can have sort of a show about addiction and sort of what's happening there on a global aspect, how many people are becoming so addicted to so many pharmaceutical drugs, but not only pharmaceutical drugs, many different sort of addictions that people are. A lot of people are addicted to CBD, a lot of people are addicted to things like melatonin. There's a lot of things that people are really struggling with. And for me, addiction is something that you're enslaved to. Without it, you can't function. And so obviously, there's addiction to social media. But I want to finish with the last question. And the question is, a lot of people do not sustain their transformations. They put things in place, they put healthy habits in place, and then 6 months later, once their conditions improved or once they're feeling better, they stop these healthy habits. They stop putting these things in place that were so important for their health and their well-being. And having been a physician for 23 years, I've just seen most patients do not continue with the supplements or the exercise or the movement or watching their sleep or their relationships. It seems to be a very difficult thing for most patients to continue. What would your advice or your top 3 hacks or your top 3 tips be for someone who's out there, who's lost weight and then regained the weight again and again? The research shows that 80 to 95% of people regain the weight that they've lost within 5 years and even put on more kilograms after that. How would you advise, your family, friends, and patients to maintain their sustained transformation?
Yeah, I think, first of all, there is human nature involved, right? Humans prefer, try to avoid pain and seek pleasure. So the pleasure in life, sidetrack them, and then they don't like the pain of having to sustain something. So we do have to accept that that's part of human nature. So the key is, I think, one, is a sense of respect for your body. So, I think we're gifted in, this incredible vessel. How do you do everything you can to do it justice? So the way I like eating. I like eating a lot, but I pick what I eat. So because when I look at things that are unhealthy, my literal response was that, oh, this is poison. So I'm going to put poison in me, and I can just imagine what it's doing to me. So if you actually, get that in your mind, that these unhealthy things are just, is poisoning your body and it's dragging you into a place you don't want to be. And that's the first thing, I think, because I think diet is, when it comes to weight, it is the number one thing to pay attention to. And exercise is the other, but, from what I've heard, 70% is diet and 30% is exercise, but they also need to optimize their body. So why are they driven to these bad habits? Do they have nutritional deficiencies? Do they have hormonal imbalances? And sometimes, they may be able to lose their weight, by starving themselves, but the underlying mechanism for weight gain is still there, or they have trouble losing the weight itself. Then you may have to dig deeper. Is there something wrong with your microbiome? What's the gut bacteria doing to you? Are you, it's a hormone completely off, off balance? So I think, people probably want to take a more proactive approach and actually go see a doctor. Like in our clinic, we have a naturopathic doctor that's actually a prerequisite for them to get stem cells. They have to see our naturopathic doctor, have to get lab tests so we can optimize everything else. So I think people need to, that's one problem I see. A lot of people are fighting a battle blindly on their own. So, as if that they can tell what's going on in their body, but we're so complex, as doctors ourselves, sometimes we don't know what's going on until we get a blood test. So you really, you need expert hands to kind of walk you through and decipher the mountains of information that's out there that sometimes are conflicting and just, it's overwhelming. So I think really dive deeper into why you are the way you are and optimize your body, and then really respecting your body. I think that's the mindset that people need to have.
Fantastic. And Dr. Kong, we wish you all the best. We declare favor and blessing over you and your work and your clinic. And incredible to hear that they have to see the naturopathic doctor first and do labs and optimize those labs. That's really powerful, because I think you're looking at the long-term transformation. You want your patients to succeed. You want them to feel better. And I think those factors are crucially important. So we wish you well, and hopefully we can have you on the show again in the new year.
Thank you so much. Yeah, when it comes to, the holistic treatment, I really feel, even though it's more of a hassle, for the patient, that they think, oh, I have to do that too, but I can't not let them do that in my good conscience. It's like, I can't, you just spent all this money. I want you to get the best results. I want you to have a long-term wellness. So that's why I'm forcing people to get it.
Yeah. Good for you. Good for you.